Welcome back. On today's episode, we're going to go through the process of laser healing and why that looks different on everyone, depending on what device we have and depending on your genetics and all the host of things that go into that. So let's get started. It is a little bit of a misconception that just the device dictates the downtime because we actually manipulate a lot of the settings that change as far as how much downtime. So in general, a fractionated technology is always going to be less downtime than a fully ablative technology, but there's a lot of nuances to that. One of the things that you need to consider is the patient's age. As we get older, the circulation tends to be a little bit poorer. The fibroblasts or any of the healing components of the cells, those tends to respond a little bit slower than if you were younger. That means an increase in the amount of downtime or redness from the laser that we're doing. So I tend to add 2 to 3 days every decade that we're talking about. So in my 20s and 30-year-olds, I would tell people 3 days of downtime, whereas in my 40s and 50s, I would probably say 4 to 5 days of downtime. And then that same laser in a 60, 70, or 80-year-old would probably be 6 or 7 days of downtime. So somewhere in that time frame, that would be realistic if they were all the same settings. Now, obviously, that depends on the patient genetics and other things that are going on in their inflammatory state, but that's in general what I would say. The older you get, you do add a little bit more downtime as far as the healing process. As always, aftercare is important because this newly formed collagen or skin, we want to protect it from all the things that made it damaged prior. So that's the number one thing is going to be sun protection. After a laser, we want to use a lot of moisture because as we have damaged the epidermal barrier or the barrier from your skin to the outside world, you need something to replace that. So we commonly use petrolatum or Vaseline or Aquaphor, something that's thick, greasy, and actually protects the skin from the outside world. This is proven to be just as effective as a topical antibiotic, so that's why we choose it. There are definitely other factors that can slow the healing process. Decrease or poor sleep, stress, cortisol levels, other inflammatory conditions that you may be battling, those may add days to your downtime. And that's why it's important to talk to your physician prior to going into any procedure. In women, estrogen tends to go down with age. And estrogen is one of the things that stimulate the healing collagen process. So as estrogen goes down, so whether that be in the postpartum era or in the perimenopausal or postmenopausal women, that tends to be a little bit longer in the healing process as well. A lot of patients ask me, what's the difference between men and women and how they heal from any laser? Men tend to have a lot more sebaceous units or hair follicle units, and that's where the laser healing process really starts. So for them in general, it takes on average 2 to 3 less days for them to heal from even our most intensive lasers. It's a little bit unfair, but us women take a little bit longer. There is good news. We have discovered a way to decrease that healing time in anybody who undergoes a laser, and that's something called platelet-rich plasma, which is your own blood, where we spin it down, get the stem cells, and then we apply it topically after the laser procedure, and you can continue to apply it during the healing process. This decreases the healing time by approximately 2 to 3 days in every person. So that's really important for people going through the laser process and how they can heal up faster. This is the laser world. So in general, what we talk about is downtime is almost equal to results. And what I mean by that is the more you can give me in downtime, the better results that you're going to get with one session. And that's because the downtime is a reflection of the amount of inflammation or the amount of injury that I've caused to the collagen. And if that's the difference between 3 days and 7 days, the 7-day person is going to have a lot more response to that collagen just because of that downtime and that damage that I have created in that collagen. So it really does do you well if you can give me as much downtime as you can. Although I understand that people have busy lives and we do adjust to that. It just may mean that more sessions will be necessary to get you the results that you're looking for. In general, my recommendation is that the first time that we do a laser, if this is your first time we're doing a procedure, we usually do a lighter laser or something with a little bit less downtime, just to gauge how long that downtime is for you, because every person is an individual and factors vary: genetics, sun damage, what you're doing as far as post care, your activity level, your baseline health, what nutrient level you're gaining. All of those things play into how you heal from the laser process. So, in general, we tend to be more conservative on our first one, and then we get the feedback from our patients. This is how long it took me to heal. This is what the process looked like. All those things feed into how we change that to optimize both the healing process for our patients and the outcomes that we're looking for. I hope that you guys learned something today about the healing process and how that differs from person to person and depending on the device or what we're doing for the patient. Thank you so much for listening. I'm Dr. Kesty. Please ask us any questions in the comments if you would like us to respond. Have a great day.